Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Azy and Dr. Arezoo Nasiry show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome back to another episode of Smile Sisters.
Hello.
Hi. So today is a big topic that people, well, first of all, let's just talk about tourism, where people fly to other countries and get a whole set of veneers done, or they redo their whole smile. They go there like to Turkey for a week and they just get all this stuff done. Tell me about that. Like, what's the deal with that? Why do people do that?
Yeah, so this has become so popular that it's now called turkey teeth, and you can see little videos online of people having their teeth cut into little pegs in Turkey, I guess.
Yeah, turkey
Not to
teeth.
single out Turkey, but that's what's happening online. And then people get crowns done over there.
Right. They just come back with like a whole set of teeth
Yes.
in like a 1 week kind of trip.
Yes,
Okay.
they do, for less expensive than you can get it in the U.S.
I guess the main reason for that is the expense, correct?
It is. But we need to talk about the cost of doing this from a financial standpoint and from a health standpoint on your dentition, because
So what is the cost in Turkey? Do you know? Like how big of a difference is it?
from my understanding of seeing our patients, let's say in the U.S. you can get a veneer done for anywhere from $1,000 to $2,000. That would be probably the average, or it can get higher than that.
Right.
I think over there you're looking at the low hundreds.
Wow,
for one.
so like a few hundred. So
It's a big
it's a big difference. I mean, I can understand someone making that choice because it's like a huge difference.
This leads into the topic of when do we need to cut the teeth and when do we not to? So a
Right.
lot of times people come and do consultations with me and say, I don't want you to cut my teeth. I only want to do this if it's no prep or no cutting. There's different brands that have come out with veneers. For example, Lumineers is a brand where
Yeah.
they say it's no, but all it means is that we're not cutting into your teeth at all.
Well, first of all, let me explain about brands. So there's brands in dentistry, just like there's brands for jeans. Like there's jeans and then there's Levi's. So there's Veneers and then there's Lumineers. And dentistry, like a lot of these companies have tried to brand their product, but it's just a veneer, but they've tried to like kind of make it more special by putting this brand on it and making it
Yes.
as if it's like something different than a regular veneer.
Yes, and I mean they will provide training to dentists, and then on the caveat or that you then use their lab to produce the
Right,
veneers.
right.
So, but you could really use your local lab to make no prep veneers as well.
Right. So we talked about turkey teeth. So turkey teeth, or any country that you would visit, most of the time they end up cutting your teeth down and putting a whole bunch of veneers on. Why? Because that's the easiest way to make it look good fast. The more you cut the teeth, the easier it is to make it look good, right?
That's totally true. When you make a lot of room for the lab to add, let's say you want to have teeth of a certain shape. If you cut enough of the teeth off, the lab that's going to make the veneers or crowns has all kinds of room to design that to the way that they want, right? So there's not a lot of thought on the side of the dentist to look at, well, how much room do I need to leave? What does the bite look like? There's all these technical things that you don't have to necessarily consider if you're just cutting all of the teeth into little cones and then just relying on your lab to
build it
put
back
the structure back up.
Yeah.
Yes.
So when we talk about no prep veneers, now we introduce a whole set of kind of like more nuances, because you don't want to cut the teeth. So you are working with a person's bite and space that they do have. So how does that work?
No prep veneers basically means that you don't cut the teeth at all and that you're layering material just on the surface of the teeth. Now, it can work beautifully for very specific cases. And you have to think about what the goals are. So if you come in and you have really small teeth with spaces between your teeth, or teeth that are inclined inwards, and you want to have a bigger smile, you want to show more teeth when you smile, you want them to be longer, more forward, then no prep veneers might be an ideal situation for you. And this happens quite frequently. Some people have a genetic thing where some of their teeth are just smaller.
Right.
You know, we call them peg laterals. Usually happens on these teeth right
Yeah.
here. And so no prep veneers are ideal for situations like that. Or other situations where you have some spacing between your teeth, but your teeth are quite narrow. So there's room to add to them, make the teeth a little wider, fill the gaps that you have, but still make it fit your face and look good without having them be bulky and thick.
Right.
So I think case selection is really important for no prep veneers. So the question I always ask when people come in is, what do you want these to look like at the end? So the most important part is to do a smile design. As you come in, we look at your teeth, we look at the situation, go, what do we want this in your mind's eye? If you had the perfect smile, what would that look like? And we try to recreate that in a model.
Right.
And then we look at the difference. Is there enough room between your teeth and this ideal smile that we're trying to get that works with your bite, that looks good in your face, that, you know, flows with everything, is functional?
And is there enough room for that material?
Exactly. There
Yeah.
has to be enough room for the porcelain and for you to be able to chew and function and bite and not have these things break off.
Yeah, I mean, dentistry, I feel, is very mechanical in nature. If you think about it, you're layering a material over an existing tooth. So it can't be too thin because then it's going to break. It can't be too thick because then it's going to look bad. So it's about finding the balance between all these different kind of requirements. Like it has to look good but not be too thin to break. And, you know, still when you bite down, you can't bite into it because then you're going to break it.
Totally.
So all this like factors have to come in to how thick or thin or the positioning of it.
So, I mean, it's totally true. And the repercussions of having them done badly are huge. I can tell you that probably on a daily basis, I will do consultations with patients that have had veneers or crowns done elsewhere, sometimes out of the country, and they are too thick, their gums are bleeding, they're getting bad breath.
Wait, why do your gums bleed if they're too thick?
So one of the issues that can happen, especially if you go somewhere and you say, I want to have no prep bonding or veneers done, but your teeth don't meet the ideal criteria, they're not small enough, they just put a thicker layer over your teeth.
Right.
And then you have this kind of ledgy situation at the gum line. And that causes a lot of gum inflammation, which we call gingivitis. So your gums get all like puffy and red and they bleed.
Right.
It traps bacteria, can cause more cavities, and just in general look bad, feel bad, and cause more issues. And then correcting that is super hard because now we got to cut all these veneers off, help the gums heal out, and then redo them. And then that's way more cost to the patient.
Right.
And, you know, a lot of aggravation and pain as well. And sometimes we can never get the gums back to the correct way that they were originally because some of the damage can be irreversible from gum disease.
Right. Not only can your gums become swollen, but you can actually lose bone because the bone and the gum are in this amazing kind of symbiotic relationship where wherever there's gum, the bone follows. And as soon as you aggravate the gum and you make it like squish it with these big crowns or you create a ledge and it's all inflamed, the gum shrinks away and then the bone shrinks away.
Correct.
So it's such an amazing system that we have that your body has created. And by introducing all these different forces, you really kind of like damage it irreversibly. It's crazy.
It's true. And what I tell my patients who are thinking, or patients that do consultations and say to me, I'm thinking about going out of town, going to another country to get veneers, bonding, or crowns done. And you can get good and bad dentistry done anywhere.
Well, let me just say, it doesn't mean all dentists in other countries are bad.
Not at
We're
all.
not saying that at all.
No.
We're just saying that when you go and you just get everything prepped and in one day, that may not be the correct solution.
Treatment like this requires some planning for us to like figure out what you need, do the smile design, review it, make sure you love it, make you temporaries to that shape, have you wear those, make sure they're functional. So it requires several steps. And then the other big issue is, well, when you go out of country, usually you're not going through those steps because you're getting in and out. You're trying to get this thing done and leave. But the second part is accountability. You know, there's good and bad dentists everywhere. But when you go get something done and then fly back home, if something goes wrong, and I see this all the time with patients who are like, well, I had these veneers and I just did a consult yesterday. She had 20 veneers done. Gums are inflamed. She had them done a year ago. She's chipped 2 of them off now.
Right.
And now, to replace those is quite expensive.
And let me just say, as a dentist, when people come to us and they say, can you just glue this back on? It's such a red flag, because as soon as we touch that, now we're responsible for it. But again, we're saying it's a whole system. You have to plan it. So it's always like, can you just glue this back on? I mean, yes, but that's not going to solve the problem.
Yes.
And it's a very hard conversation to have, because someone's had all this work done.
And it's heartbreaking, honestly,
Yeah.
because now you're telling them, well, really, to make this right, we have to kind of replace all of this, and here's what's going on with your gums, and here's everything we have to do, and here's the price tag associated with that. And they're going, but I just went out of country and paid all this money. And the problem is that dentists out of country, even if they have good intentions, they're not even seeing the result of their work.
No, it's hard. The follow-up really matters. The follow-up really matters.
So having a local dentist that's accountable, we're here, you know where we are.
Yeah.
If something falls off, we're going to be here to correct it. And not that we would ever want to do anything that's going to fall off.
Right.
But now we get to see the mistakes that we make and correct those.
Right.
And do better by our patients. So accountability is super important, and that's, I think, the biggest problem with getting treatment like this done out of the country. Is that there is no accountability, and there's no recourse for the patient, because it's very hard to be flying back and forth over there and getting
like
things
it's something
corrected.
chipped. You're not going to fly back to Turkey or
And then
wherever.
those dentists are not seeing the results of the mistakes or the issues that arise from the treatment that they do, even if their intentions are to do really great work. If they're not able to follow up with their patients and really evaluate their own work, they're not learning and improving. And that's a big problem.
Yeah, it's a huge deal that whatever we do, we see you back over and over and over again. We follow you. We can see what happened to these crowns or these veneers, and
Totally.
we can see like, hey, this worked, this didn't work. Let me fix this. How can we improve?
Yeah, it's a huge part of
It's
our
a huge
learning
part
process.
of it. Yeah, for sure.
And
that's why it's called a practice.
that's right.
It's never done.
It's never done. We're always trying to improve, and you guys help us with that as our patients.
Yeah.
So you definitely want to get treatment done with a dentist that you love, that is hopefully, close by enough to you. It doesn't have to be in your same city, but something you can keep going back to. Certainly I do treatment on patients from out of state who fly in and do work, but I want to see them for regular follow-ups. I'll be like, how often do you fly into LA? What can we do to, to make sure things are going well? We do virtual consults. We do virtual follow-ups, So there are ways to get around that. You just want to find someone who will be your partner through this journey and with the follow-ups that come with it.
That's right. Yeah.
But no prep veneers. I just wanted to talk about the difference.
Okay, yeah, sorry, we
between
got
these-
way off
we
track.
Did, we got into a philosophical
We went to
conversation.
Turkey.
We did. So, okay, prep or no prep, right? That is the question.
Okay.
So sometimes you can have no prep on 2 of your teeth, but then you have to prep the other 2 to get the right shape. So the way that we do this is we do the smile design, then we layer that. We can actually take the model that we created. We can layer it right over your teeth without cutting into your teeth at all. And then we can basically measure what is the distance between your tooth and this layered material on top.
Right.
And there is a certain minimum amount of porcelain that we need for the veneer to adhere. And it's very little. It's about 0.5 millimeter, depending.
Right.
And so we can actually cut into the layered material 0.5 millimeter and then remove that material. And then often we haven't cut into your teeth at all, or maybe just a few corners of a couple of teeth.
Right.
But anyways, this is the guide that we use so that we don't over-reduce your teeth. We don't remove anything that we don't have to. So it becomes very technical and very accurate in the removal to make just enough room for the porcelain to be layered on top.
I mean, I love it when people come and they're like, how many inches are you gonna? It's like, no. We're talking like 0.1 millimeter. Like
it's very small amount.
So small. Yeah. It's like we can't even think about it in inches. Like that's way too big of a measurement.
Yes. But we do have to think about it, and that's the thing, you know. So you layer this, you cut through it, you remove it, you check, you evaluate, is this gonna work or not? And when you go somewhere and they just cut everything into a little pointy cone, they don't have to make those evaluations.
Yeah.
But that's a risk to your teeth. So statistically, the more tooth structure you have left, the healthier that tooth is going to be in your lifetime. So as soon as you start cutting into your teeth to a significant amount, that means removing the enamel or the hard shell of the tooth, okay, completely, then the prognosis or the long-term health of that tooth goes down by quite a bit. It's way more prone to fracture and to ending up needing root canals.
And causing pain and other issues.
Yeah, which might lead to root canals and possibly loss of your teeth in the future. So being minimalistic now really saves you down the line.
Right.
Once your tooth has been cut into a crown and then there's another problem with the tooth, let's say now there's a gap under your crown or something. Now it just becomes more and more invasive. You can never go backwards. You can only go forward.
Teeth don't grow back like other parts of our body, like our
don't.
skin or something else.
Exactly. Yeah. Once they're gone, they're gone. So you want to see somebody who's very conscientious and able to maintain as much of your tooth structure as possible.
Yeah.
Super important.
As much as we try to, with all these different materials and brands, there's nothing that can come close to your human anatomy. It's just, the enamel and the dentin and all these amazing things that, your body has. We cannot actually recreate it perfectly.
We cannot.
We cannot.
And once you cut into a lot of that enamel, the hard shell, your tooth becomes way more flexible. That enamel, it's like the outside layer of your tooth, creates the stiffness that you need in your tooth.
Let's talk about what layers of the tooth, because people may not know. So I always explain it like teeth are like M&Ms. There's the harder outer shell, and then inside is like a softer, gooey chocolate. Yes. And then even there's a third layer in there, which is like a liquid, like the
a caramel center. Think of an M&M with like a caramel center.
Exactly. Yes. So once you cut through that harder outer shell, now you just have this like flexible, more like doughy material, and that's called dentin. And the harder outer shell is called enamel.
Yes. And so if you cut all of the enamel off, which you do when you get the preps done where they cut your teeth into a cone, you only have that gooey chocolate middle left.
Yeah, that's all you have.
And that is way more prone to just breaking, with force on it, even if you layer something hard on top of it. And so if that breaks, now you go into the caramel center. Yeah. And that is where you might need a root canal.
And that's your nerves and blood vessels in the teeth. And
a lot of problems.
That can cause a lot of problems.
Yes.
So no prep veneers are the ideal, but just to summarize, but it does require more planning, more thoughtfulness, and maybe like planning a few steps ahead rather than just cutting into the teeth to create space.
Well, let's talk about that for a second. No prep veneers are very case specific. So they can work in very specific cases. Mm-hmm. And it all has to be geared towards what is the cosmetic outcome that we're looking for, and maintaining good gum and oral hygiene health by not making these things too ledgy. Chunky. And so often what I see with bonding that's done is that they leave a ledge at the gum line, and that can cause a lot of issues for your gums in the long term, a lot of health problems. So in certain situations, case selection is really important for no prep veneers. So what happens when you have a patient whose teeth are sticking out like this and they want veneers to make them go in and make them look nice? Right. So obviously you have to prep in those situations, because if you don't, the teeth are still going to be sticking out. Right. You're layering more on top of them. So do you prep those teeth? Maybe you do some orthodontics first. So probably about 80% of our patients that we do veneers on, we have first done some sort of orthodontic treatment like Invisalign on, to put the teeth in an ideal position. Right. So often I'll plan these cases together. We'll do Invisalign, and I'll actually tuck the teeth in a little bit more, just enough to give me room for those veneers to sit on top of them after. So combo cases like that can turn a situation where you would have to prep a lot into
Right,
the teeth, into a situation where you're not prepping at all or prepping very minimally just to adjust.
So the teeth that are sticking out are now in a even more inclined position, and now you can just layer that porcelain or bonding or whatever over it, and now it's going to look great, and you didn't have to cut the teeth at all. You just moved it in the correct position.
You just moved it, and that's like a forward-back movement. But sometimes you move the teeth side to side. So if your midline is over here a little bit, and you want to bring it to the middle, or you have some spacing between your teeth, but maybe you have more of a gap on your right side than your left, and then you want to close it with veneers, but you don't want to have like one wide veneer here, one narrow veneer here, you know. So putting the teeth into the middle, even if you leave the spaces, but making the spaces evenly distributed.
Right.
So those are the things that we plan out before we do the cosmetic work.
Right.
And then we plan it into the Invisalign. Get the teeth ideal so you can see what it's going to look like at the end after your Invisalign and your veneers from the beginning.
We can pre-plan the whole thing digitally.
Yes, we can.
And then you can see it all.
See what it looks
It's
like.
very cool, the technology.
Yeah, it's really fun. Yes.
I hope that was useful. Thank you for listening, and see you next time.
See you next time.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.